The chair recognizes Representative C. Johnson.
Thank you, Madam Speaker. Colleagues, today I rise to ask you to take action to reduce racial health disparities in our state. The amendment before us would restore $8.4 million for new initiatives that would reduce health disparities. You know, sometimes I get tired of hearing the same things about the disparities or the plight that Black people go through. I do. I know you do. Including increasing use of the amendment before us would restore $8.4 million for new initiatives that would reduce health disparities, including increasing use of community-based navigators to facilitate access to health care and a statewide screening referral tool for health-related social needs. Funding is designed to provide some much-needed access to health coverage and other supports. As many of us know from the COVID-19 pandemic, there are some serious economic and racial disparities that exist within Michigan's health system. Even before the COVID-19 outbreak, I don't know about you, but many of us knew that the health care system didn't always serve Michiganders of color equally. An example that we should all be familiar with is the high death rate of Black mothers.
Representative, can you keep your comments to the merits of your amendment? Chair recognizes Representative Johnson.
I want to know which one you're telling me to keep my comments because I'm reading an example that we should all be familiar with is the high death rate of Black mothers. Is that incorrect? From 2011 to 2015, Black women were 3 times more likely to die from pregnancy-related causes in Michigan. Neither socioeconomic status nor level of education diminished the rate. So it didn't matter how educated we were, or how much money they had, or what kind of insurance. When they entered a hospital in Michigan to bring new life into the world, Black mothers were 3 times more likely to die in the process. And now, as we can look back on the early stages of the pandemic, this trend continued to prove deadly. Despite being more likely to die from COVID-19, many racial minorities, but Black people in particular, were often turned away from hospitals and healthcare facilities multiple times without receiving help. For many, the color of their skin was a death sentence. This is unacceptable. Colleagues, we need this funding to ensure that no one who goes to the hospital or medical facility, regardless of who they are, no one leaves without receiving the care they need because of their race. We have a chance here to be a leader in improving health disparities and improving health outcomes for racial and ethnic minorities. Let's take it. Please join me. And vote yes on this amendment. Thank you.